Welcome back. The window to change or update Medicare health and drug plans opens each fall. For 2025, the open enrollment period is October 15th through December 7th. Your current plan may look fine, but small tweaks in costs, coverage, or your health can make a new plan a smarter move. Joining us for Insight is Lawrence Sprung, founder of Midland Financial and author of Financial Planning Made Personal. Good morning, Larry. Good to have you with us. Now, we mentioned small tweaks or other changes. What's the range of things that people can change about their coverage during this time period?
Yeah, so during this time period, Steph, people can drop or switch Medicare Advantage and Part D drug plans. And, these changes are important because you have the opportunity to make them, as you mentioned, between October 15th and December 7th. Everything's locked in on that date. And then those go into effect for January 1. So it's important to evaluate what options are available to you during that time and make changes accordingly if that's something that makes sense for you.
And what's new for Medicare plans, and why does it change year to year?
So, they often change their provider networks, they change drug formularies, premiums change, and even out-of-pocket costs. And, what may be or what was best for you this year may not be best for you next year. So you want to evaluate all these things on an annual basis. And one thing you should be aware of when it comes to prescription in particular is for 2026, all Medicare plans, doesn't matter which one you're on, will include a $2,100 cap on what you pay out of pocket for covered prescriptions. So that's important to know too.
Certainly. Now, people whose plans have changed will have received some kind of notification. Not everyone reads them. What's in these notices that we should be paying special attention to?
Yeah, so whether your plan is changing or not, whatever plan you're enrolled in for the year, and you probably should have received these already because they're required to arrive before the annual enrollment opens. And there are two notices. One is an annual notice of change, which is basically outlining any specific change with regard to the plan you're currently in. And the second document is an evidence of coverage, which also shows you what your current coverages are. So basically, these documents highlighted all the changes in your premiums, your provider networks, your drug coverage, any rules and prior authorization policies that you currently have. So you want to make sure that you read them and understand what your current policy actually includes today and what it's not going to include next year and how that change may affect you.
And what do you suggest people check, especially in their plans each year? Is there anything in addition to what you've already listed out?
Well, I think the two most important things that people should be aware of is, most of us have doctors that we really like and enjoy going to. You want to be mindful if that doctor has been dropped from your network or they changed, right? And then the second piece is prescriptions. That has a tendency to have a bigger cost associated with it. So sometimes one plan to another, there could be a huge difference in the cost of medication. So if your current plan is looking that like your medications are going to go up in price, you might want to look at running that through other providers to see if you can get that at a lower price. It's kind of crazy, but the same drug on one plan could be $8 a month and on another plan could be $80. And it's the same exact drug. It's just the method and means by which they cover you.
Good to know. Now, this can all seem a bit complicated sometimes, especially with the annual change. Is there any help out there who folks just may be feeling a little lost?
Yeah, so there are a couple of tools that some people may not be aware of. You can run your specific drug list through Medicare's Plan Finder tool. You could just simply Google it, and you can compare the total of your projected cost premiums and copays to what it might be. The other thing is most states, or if there's a state health insurance assistance program, it's called SHIPS, they offer unbiased counseling to help you compare these plans. They want to make sure that you're choosing the right plan. And finally, and lastly, Medicare.gov, they have a plan finder tool that will compare apples to apples plan options in your zip code, because many of these plans are dependent on the state you're in as well as the zip code. So those are three great tools that you should start evaluating immediately. Don't wait till December 6th to start looking at it. We have, 6 weeks here, 6, 7 weeks. Utilize it and make sure you're making the best choice possible for you.
Yeah, good to know all of this information. Lawrence, you work with families throughout generations, even on planning their finances. Are there any key issues that you notice coming up around health and finances that tend to come back and influence generational wealth building?
Yeah, I mean, I think that one of the biggest, question marks when it comes to somebody's financial future is what is their health going to look like? And secondarily, what is the cost going to be to either keep them at that same healthy state, keeping them alive and well, whether that's like long-term care or just simply, some kind of disease. And, if you don't plan properly for these unseen and unforeseen circumstances, it could take a financial toll on a family, let alone a financial toll on the financial future and that generational wealth that you speak of. Because again, we can plan for it as best we can, but we really don't know how that's going to play out. So the best thing and the best advice I could give people is eat healthy, exercise, start taking care of yourself earlier in life so that those health costs may be less of an issue later on, hopefully.
Good to hear all your thoughts on this. Very well-rounded advice. Appreciate it so much. Lawrence Sprung, good to speak with you.
Thank you, Steph.